Composite bonding is a very popular treatment and the demand is growing and growing every year. And the reason is because it's a very simple procedure to do, it's very conservative, non-invasive, requires no drilling whatsoever, and it is very comfortable for you as a patient. The endless possibilities of bonding makes it very, very popular. And that's because we can do so many different things like closing gaps, or completely change the size of the tooth or the shape of the tooth. We can close diastemas, we can cover and mask white spot lesions. So there's endless possibilities to what you can do with a composite. Composite bonding uses a white resin that we apply onto the tooth, and it can be edge bonding just to the surface and to the edge of the tooth, or it can be composite veneer where we cover the entire surface of the tooth just like a shellac nail. The layering, texturing sort of procedure is a very simple one, and what we do is we use an etch agent to clean the surface and to roughen the surface to a micro level. Then we use an adhesive, and finally we add the composite into layers onto the tooth or teeth that we are treating. It's a very simple procedure to do, it's a very quick one to do as well, and most cases are done under 2 hours, so you can have a brand new smile in less than 2 hours. That's pretty amazing. In terms of maintenance, of course, there is some maintenance to it, but it is quite a low one, and that's why it's so popular.